All right. Hello, everybody. Dr. Rafich here, Vet Triage. It is November 1st, Friday, 10:55 a.m. Pacific time. We are going through this issue of JAVMA here. This is the May 15, 2018 issue, and we are doing the Theriogenology question of the month. So let's get into it. 4-year-old, 1,400-pound Brangus bull was seen for lameness. And during the examination, they realized that he had asymmetric testes. The lameness was due to a subsolar abscess of the lateral claw of the left pelvic limb. Solar implies a part of the hoof, so subsolar is beneath that. An abscess is a pocket of inflammation and fluid. Lateral claw is the outside claw, whereas medial claw is the inside claw. So a 4-centimeter firm mass was palpated on the dorsolateral pole of the left testes. They performed an ultrasound, found a well-circumscribed heterogeneous hypoechoic echo texture, and the mass was in close proximity of the head of the epididymis with no direct association with the epididymis. So heterogeneous means, as opposed to homogeneous, which is patchy coloration. Homogeneity is the same color throughout. Hypoechoic means that the ultrasound machine is showing a darker texture to it, darker colored. And echo texture just means the texture of the thing based on echo waves, and that's what ultrasound is based on. They did electroejaculation to get a semen sample. They found no gross or individual motility of spermatozoa. Spermatozoa is a long word for sperm. The ejaculate had multiple round cells. Only 1% of the sperm were normal. 40% had primary abnormalities. 59% had secondary abnormalities. The predominant abnormality was detached, normally shaped heads of the sperm, and the most common primary abnormality was vacuoles within the heads of sperms. They also found neutrophils. And so this is the two black and white images are ultrasound images of the affected testes, and then that green area you can't see well on camera, but there's not really much to see there. There's like sperm heads and some cells. But so the differentials for this were inflammatory lesions like sperm granuloma, epididymitis, testicular abscess. Cancer was on the list, including interstitial cell or Leydig cell tumors, sustentacular cell or Sertoli cell tumors, seminoma, testicular germ cell tumor of the non-seminoma type, teratoma and lymphoma, and then developmental anomalies such as the segmental aplasia of the epididymis and paramesonephric cysts. So results of this case, they removed the left testes with surgery, hoping that the contralateral testes will start to function normally. The bull got penicillin after surgery, aerosol bandage, hydrotherapy, flunixin. Culture was negative. And they found on biopsy that the architectural disruption was there. There was collagen, intense inflammation, widely dilated epididymal ducts, pycnotic eosinophils. So pycnotic means that the cellular structures are small, smaller than normal. Neutrophils, spermatids, which are sperm, and epithelioid macrophages, multinucleated macrophages, plasma cells. There was perivascular distribution of these cells. Ultimately, all that to say that this is how you describe a sperm granuloma, which is a diagnosis in this case. So now we're going to go into the discussion. Oh, and by the way, for those who care about the histopathology, there you go, a bunch of cells. If you notice the cells in this top picture being in a spherical, that's typically what perivascular means. It surrounds a blood vessel. And then a close-up here shows all the plasma cells that are in on the histopathology. Okay, first an anatomy discussion regarding bull testes. The testes of bulls are contained within a pendulous scrotum and are dorsoventrally elongated. The head of the epididymis, which is where the sperm are stored, is located on the dorsal pole, so the top part. The body of the epididymis is located along the axial surface, so the outside part, and the tail of the epididymis is located on the ventral pole, so the bottom part. Parenchyma of the testes contains tubular and interstitial compartments. The core of the parenchyma contains a mediastinum, which contains the rete testes, that's R-E-T-E. So there's two compartments to the testes. So the tubular compartment of the testes consists of highly convoluted seminiferous tubules, whereas the interstitial compartment, that's the second compartment, comprises blood vessels, connective tissue, Leydig cells, and they surround the seminiferous tubules, which make up the tubular department. Seminiferous tubules, so in the tubular compartment of the testes, are the site of spermatogenesis, which is formation of sperm. And they include Sertoli cells and germ cells. Sertoli cells extend from the basement membrane to the base of the line of cells to the lumen, which is the space within the cells. They surround the germ cells and are often referred to as nurse or governor cells because Sertoli cells provide structural and functional support in the developing spermatocytes. So as sperm goes through the development, the name changes. That's why you're hearing spermatozoa, spermatotids, spermatocytes. Adjacent Sertoli cells are connected by tight junctions. Tight junctions are structures between cells that hold them together. And these tight junctions contain occludins, claudins, and junctional adhesion molecules. All that to say that this is what forms the blood testes barrier. All these structures are located on the basal third of the seminiferous epithelium and separate the tubules into adluminal and basal compartments. Tight junctions separate the germ cells located in the adluminal compartment from blood supply that creates the blood testes barrier. So there are certain areas of the body that are immunoprotected, meaning the immune system cannot enter as long as you have a normal barrier. And the blood-brain barrier is a commonly known one where cells can get into your brain through the bloodstream unless there's a problem with the blood-brain barrier. The same thing here, the blood testes barrier is also a immunoprotected area. So those are just two examples. There are a few others. Spermatogenesis occurs in the tubulus contortus section of the seminiferous tubules. These tubules are surrounded by contractile peritubular cells, so they contract, which promote flow of the tubulus contortus into the rectus or straight portion of the seminiferous tubule, which in turn intersects the rete tubule. Spermatozoa travel from the rete tubule to the efferent ductules. Now, the efferent ductules, which are embryologically derived from mesonephric tubules, are located at the head of the epididymis. These ductules provide communication between the rete testes and the head of the epididymis. The efferent tubules consist of three segments: a nearly straight portion that exits the rete testes, a highly convoluted central portion, and then a moderately coiled terminal portion that enters the epididymis. Ductules are lined with absorptive epithelium that promotes spermatozoa transport via resorption of water and encourages the movement of sperm into the ducts. Cilia, which are microscopic hairs, line the epithelium and further support movement of sperm towards the epididymis. The number of efferent ductules in each epididymis of the bulls range from 10 to 20. The epididymes, which is plural for epididymis, are also derived from the embryologic mesonephros and are divided into three segments: body, head, tail. Sperm travel from the efferent ducts into the head of the epididymis and then move through the body and tail. All three segments can be examined by palpation. Similar to the seminiferous tubules of testes, the epididymal lumen is maintained as an immune-privileged site isolated by the blood epididymis barrier. So there's a third blood barrier is the blood epididymis barrier, composed of the basolateral membrane, apical membrane, and tight junction complexes between epithelial cells. These complexes contain proteins called claudins, connexins, and catenins. The sequestration of sperm antigens while in the lumen of the seminiferous tubules and epididymis, combined with the restriction of entry of immunoglobulins and immune cells into the lumen, prevents sperm antigens from contacting immune cells. You can imagine if immune cells were allowed to interact with sperm, you'd end up with basically the immune system acting attacking the sperm as if they are infectious or foreign to the body. We don't want that, of course. We want to keep the sperm healthy, and so that's why it's set up this way with these tight junctions. Typically, monocytes, macrophages, CD4 positive cells, and T cells are present in the epididymal epithelium and interstitium, but are not found in the epididymal lumen. If sperm or testicular germ cells enter the epididymal interstitium, after disruption of the epithelium, the marked immunogenic response to antigens contained on the sperm will accumulate into a sperm granuloma. A sperm granuloma of the epididymis may result in the sequela of multiple inciting causes. The most common cause is congenital abnormalities like aberrant or blind efferent ductules. You can imagine if you have abnormal ductules and sperm can't travel through them, you'll have a buildup of sperm, and then that causes a problem. But also it can be due to infectious agents that lead to epididymitis, traumatic injuries, autoimmune disease, vascular disease, and adenomyosis of the epididymis secondary to estrogen. So now we're going to go into the two different congenital malformations of efferent tubules. The first is aberrant efferent ductules, can be defined as ductules that terminate at a site located distant from the expected site of fusion with the head of the epididymis. And then blind efferent tubules, or ductules rather, are located within the head of the epididymis but fail to anastomose with the epididymal duct, which results in ductules from which sperm and fluid cannot escape. Blind efferent ductules are found in 12% of bulls, aberrant ductules 20%. Accumulations of sperm in these dead-end ductules eventually to stasis of the sperm, and sperm accumulate within a dilated epididymal duct, sometimes referred to as a spermatocele. As the lumen of the efferent ducts become increasingly occluded with sperm, the lining of epithelium becomes stretched, flattened, and starts to degenerate. These changes lead to severe epithelial damage, loss of the epithelial lining, and then you get focal denuded areas. After you lose the blood epididymis barrier, tissue fluid, macrophages, fibroblasts, lymphocytes, neutrophils migrate into the interstitium and start to mix with the sperm. Spermatoceles are different from sperm granulomas by the presence of granulomatous tissue reaction that follows the extravasation of sperm into the interstitium. Large spermatoceles and sperm granulomas of the epididymal head may be palpable. So you look at the ejaculate and you'll see detached sperm heads and germinal epithelial cells, which is what we found in those samples. These sperm granulomas on ultrasound are anechoic, meaning they have really like no color to them. So they're not bright, they're not dull, they're right in the middle. Distinct margins, meaning that they're not irregular or hard to define. They have distinct margins, and they may or may not have a hyperechoic capsule, so like a bright capsule. Normal testicular parenchyma should be homogeneous, which means it's the same throughout, and moderately echogenic throughout. The width of the mediastinum testes should be 2 to 4 millimeters. The head of the epididymis can be identified on the proximal cranial aspect of the testes. It should be less echogenic than the testicular parenchyma, but homogeneous in texture with thin echogenic lines. Infectious causes of epididymitis include Brucella abortus, Mycobacterium bovis, and Trupperella pyogenes. But they had negative culture results in this one and they didn't see any bacteria on the histopathology. The sequence of events, meaning injury followed by fibrosis, then leads to sperm granuloma, is what they thought was the cause here. I'm sorry, what they thought was unlikely here because there was no evidence of injury, trauma. Outcome. So expected return to normal sperm function should be 60 days after. However, with unilateral castration during summer months, the physiologic testicular function may not resume until ambient temperatures become moderate. And that's when you can start breeding the bull again. There we go. So cool case. I knew nothing about bull spermatogenesis and testicular architecture. That's pretty cool. Great case. Thanks to the universities for putting that together. And I'll see you guys again tomorrow for another tantalizing live stream. Take care.